Hello everyone, my name is Sushma Kumari, MPed 4th semester. So these are some contents about the tuberculosis. About tuberculosis. So going further, start with Indian history. Around 500 BC, it is known as this tuberculosis is known as moon god, and this is also called as Rajakshma or king disease. In middle of 19th century, tuberculosis is common in the. Now next one is introduction. So tuberculosis short name is TB, and it is a contagious disease which is caused by the bacteria and found anywhere in the body, but mostly in the lungs. It is second biggest killer globally. Next one is types of tuberculosis. It can be divided into two types: latent tuberculosis and active tuberculosis. Latent tuberculosis means bacteria inside your body in an inactive form. They have has no symptoms and they are not contagious, but they can active in any time. Next one is active TB. It is bacteria inside your body in an active form and multiplying rapidly. It affects other organ and other people also. And another type of tuberculosis is like pulmonary and extrapulmonary. Pulmonary tuberculosis means tuberculosis inside your lungs, and other than lungs, if organ affect other than lungs, that is extra. Next one is spread of tuberculosis. It is caused by the Mycobacterium tuberculosis, and it is spread through the droplets released into the air, and it is also spread due to the someone's people having tuberculosis, their speak, laugh, split and sneezing. And it is also spread between your family members, close friends and people who work or live together. It also spread in closed spaces over a long period. There are various causes. They are HIV infection, low socioeconomic status, alcoholism, lack of physical exercises, crowded living condition, disease that weaken the immune system. These all are because of these all HIV infection and all are weaken our immune system, which is favorable for the growing or going inside bacteria into the body. Next one is symptoms. The people having tuberculosis may see various symptoms like feeling sick or weak, a persistent cough, weight loss, loss of appetite, fever and night sweat, coughing up blood and chest. Next is the person which one is more affected by tuberculosis. So they babies and young children are more affected by tuberculosis because their immune system is not matured, and people with diabetes and chronic diabetes and kidney disease, and people with HIV AIDS, and people which organ transplant recipient, and next is and last one is cancer. So there are various tests which diagnose the tuberculosis. So first test is skin test. Skin test is mainly uh, done through the injection of liquid to your lower arm of the hand. That liquid is called tuberculin. After 48 to 72 hours, we can see that swelling and redness of your hand. The more swelling and redness, it means more bacteria inside your body. Next one is interferon gamma released assay. This is a blood test. We can take sample and test your blood and detect the bacteria inside your body. Next is culture test. Culture test is uh, culture test is done to see the bacteria growing uh, on the other substance. we take sample of sputum and then we mix some liquid which is favorable for growth of the bacteria, so we can detect the growth of the bacteria on other substances and know that which type of bacteria or mycobacterium tuberculosis is inside your body or not. Next one is sputum smear microscopy test. This is test in which we take sample of sputum and it put into the slide and see through the microscope and detect the mycobacterium tuberculosis. Next one is chest x-ray. The people which have active tuberculosis, their chest is swell out, so we can check through the x-ray of the chest. And next is serological test. This is the first test to detect the tuberculosis, and this test is say that we can take a sample or we can detect a tuberculosis through the counting of antibodies, but counting of antibodies is very difficult, so this test is. Next one is treatment. First, tuberculosis is a curable disease. It can be treated, and it can treated with the mainly antibiotic which kill the bacteria, and there are various doses for the different type of tuberculosis. So first, treatment for the latent TB. These are some antibiotics: isoniazid, rifampin, these are for the different doses for different months, because the people having normal people have tuberculosis take less time to treat, and person having uh, previous some kind of diseases like diabetes, hypertension, they take more time to treat. Next one is treatment for active TB. This is also because person having active TB, so more days to take for the treatment. So it take to 6 to 9 months. These are isoniazid, rifampin is a dose for the treatment of active TB, and we can take 3 or 4 medication for 2 months, and then after few months we feel better, but don't stop without consult to your doctor. Next one is treatment for drug resistant TB. Drug resistant TB means TB is not through the bacteria or due to the immune system of weaken of the immune system, but it is due to the drug which you taken for the treatment of other type of disease, that is called drug resistant TB. So for this purpose there are three types of antibiotic which we take for 20 to 30 months. Next one is prevention. Prevention, these are some steps which we follow, we can prevent tuberculosis. So take medication on time, keep on doctor appointment, always cover your tissues which is cut or wound, and other. Next one is don't use public transport and don't move. So there are some facts about tuberculosis. The tuberculosis World Day is celebrated on 24th March, and there are various countries which is more affected by tuberculosis. It's my last slide. So if you like my videos, share and comment. Thank you so much.